Well, here we are again on Peer TV. Absolutely delighted to have Becky Keating with us. I genuinely love public health, but I'm not going to go there. I'm just going to get Becky to explain what she actually does and what the team of public health do. And she's going to obviously introduce herself as well. So, Becky, welcome to Peer and Beyond. How are you?
I'm really good, thank you. Thank you for having me today.
Awesome. And can I just plug in the fact that the public health team at North Somerset Council, got nominated for an award. So at our recent conference. So well done, you.
Thank you.
What a great job that you guys are doing. So over to you now to do some introductions and what you guys do.
Lovely. So I'm Becky Keating. A delight to be here today. So public health in North Somerset Council. We do a whole range of different things. So we have our health protection team, who you will be familiar with as part of the COVID response. We're always in the background, kind of if there are any emerging issues happening, keeping our population safe and supporting in that way. We also we have health and care public health team, and that's the service that I lead. So I'm a service leader in our health and care public health team. So we support things like sexual health, drug and alcohol services, such as We Are With You may have heard of that local provider, and also our smoking cessation services, alongside some research aspects. But we also have our health improvement team, who are supporting a whole range of other services, such as, kind of your early years services, your infant feeding support, school nursing, and health visiting services, as well as things like our staying active services, our healthy lifestyle advisors, who we work in partnership with yourself to deliver in the peer health PCNs, but also supporting the commissioning of services for supporting mental health and well-being, alongside things like men's health. There's the whole raft of different elements of public health. So it's as broad as it is deep, and there's always something to learn. Is what I'm finding, being new into this speciality.
Yes, and you've come into this from an OT background, haven't you? How does that help you in the day job now? Because that's a very interesting move.
Absolutely. So occupational therapy, I've been an OT for over 20 years now, and I have a range of experience in different settings, both clinically, but also leadership and management of different services, as well as health commissioning as well. So occupational therapy is very, very aligned to public health, looking at promoting independence, supporting people to do what they want and need to do in their own individual lives, and understanding some of those wider determinants of health. So I see lots of synergies and connection in my professional background that I can bring into my current role. So yeah, it's an interesting collision of these two different things.
Oh, I absolutely agree. And North Somerset is a really cool county for so many reasons, because primary care is working hand in hand with you guys in public health. It'll be interesting to understand why we're doing so, just to educate anyone that isn't quite sure why, in terms of why we're doing that. And also, if there's any message you'd like to get out to the public whilst you're doing this education, then do so. Or any message you'd like to get to our teams whilst you're doing this education, then chip that in. But why is it even? Why do we even bother to work together?
Absolutely. So working together is absolutely vital. So public health, do work in kind of a collective effort, kind of with our communities, and with our partners, kind of within the community, to make sure that our people can live well. the reason why we do this, it's so important with our colleagues in the PCNs and primary care, is that actually it's often seen as the gateway to services, to advice, to, you know, that synergy around prevention, but also around making sure that you know, we're understanding and addressing health inequalities, and we, you know, it's such a shared challenge, but such a, you know, kind of an important topic for us to work together on, that actually, you know, kind of we need to embrace the opportunity to understand our communities better, and to work hand in hand. So I think we have commissioned public health services from yourselves over the years, including things like health checks. You know, kind of we've got, as I said, the you know, the activity advisors, as well as a range of different services. But what we're asking ourselves is actually, you know, kind of, are these having the impact on our local communities that we're wanting it to? So I think you know, the message is get involved, you know, understand what is out there in our local communities, and to you know, to not be afraid of trying something different. So yeah, so I think it's around, you know, kind of tell us, you know, the communities tell us, you know, kind of how we could deliver services better, and yeah, we'd be delighted to innovate together.
Brand new service that we're working on together with you guys, aren't we, from a lifestyle perspective? Tell us a little bit about that, and yeah, what we're hoping that does from a health inequality angle, because I think you mentioned that we do have some pockets of deprivation within our county, and so this is really rife. So why don't you tell us a little bit about how that will support that big challenge of health inequality?
Absolutely. So yeah, so we do have some of the most you know, kind of deprived areas in both the county and also the country, in our south and central wards, and recognizing that there are some, you know, some structural and, you know, kind of real barriers to you know, to health and well-being. The support of healthy lifestyle advisors is absolutely key. So through some of those really, you know, kind of simple but effective ways of improving well-being through physical activity, through supporting someone in terms of their mental health, thinking around a healthy diet, and helping to reduce levels of obesity, and looking at also things like drugs and alcohol. You know, kind of sometimes there is a, you know, kind of the self-medication of even small, you know, small levels of drugs or alcohol can have such a big impact, and it's really important that people reach out for help. We've got some really excellent services available, and yeah, you know, kind of it's around recognizing that small changes can have a huge impact. So supporting someone to be able to remain in work, you know, all of these different things can have such a big impact on their health outcomes. And so we're willing to, you know, to offer up that support, you know, kind of working shoulder to shoulder in a personalised way, recognising that people sometimes need things done in a, you know, a more individualised way to meet their needs.
That's awesome. I mean, it's such a, like you said, a broad sort of, I call a broad buffet that you guys have got on the table. It's just a matter of picking what is required, isn't it? So it's really good to hear from you and to get this education from you as well. So in terms of our teams within Pearden, what message would you like to get out to them through this recording?
Yeah, sure. So yeah, so it's great to be working alongside you, and I think it's around an invite. You know, kind of do reach out, do ask. I'm very happy to come and meet you, to, you know, to offer some training and support if that is of interest. And yeah, I think it's just great to recognise on, you're probably doing a lot of public health stuff already, and it's just kind of bringing that to the forefront of what we're doing, to make sure that we're being as effective as possible. So yeah.
Becky, you guys do an amazing job of public health from a data perspective to supporting, to guiding us. We appreciate you. You work really well with us in primary care as well. So we appreciate all of you. So thank you for coming to talk to us. Hopefully you'll come back again and talk to us when there's some new innovation going on. But thank you for your time today.
Oh, thank you. The pleasure's mine. Thank you.